everyone, I'm Dr.Garima Asati. Welcome you all in my YouTube channel. Friends, today I'm going to explain you about the topic urinary tract infection in English on the demand of few of my non-Hindi patients. So let's continue with this UTI. So when this infection occurs in the lower urinary tract area, that is bladder, then it is termed as cystitis, and when it affects the upper urinary tract area, that is kidney, then it is termed as pyelonephritis. Friends, before that, if you have not subscribed my channel till yet, kindly subscribe the channel, tap the bell icon to get the latest updates of the videos, and kindly see the video till the last, because in the last I am going to explain you about some of the homeopathic medicines which can be helpful in curing this UTI. So let's continue with this UTI. Now let's talk about the symptoms of this urinary tract infection. So in case of lower UTI, there is severe burning, frequent urination. In spite of empty bladder, patient feels urging to urinate again and again. There is itching sensation, and along with this, nausea, vomiting and fever occurs, and these are the accompanied symptoms with this lower urinary tract infection. Or in case of upper urinary tract infection, that is when kidneys get involved, pus cells become present in urine, or it may be bloody urine, that is hematuria. There is pain in the flank region seen in cases of kidney urinary tract infection. In infants, this UTI represents itself as with fever, and in young children, there may be fever with chills and rigor, as well as there is loss of bladder control seen. And in cases of adults, there is fever, rigor, chills, as well as sepsis may occur in adults. And along with this, there is burning in the urine, as well as itching and pain in the flank area. Now let's talk about the causes of this UTI. So some bacterial or fungal infections may occur, like Escherichia coli infection or any bacterial infection. Female anatomy is the risk factor, and sexual intercourse, that is honeymoon cystitis, is one of the most common cause of this UTI. Diabetes also increases the risk factor for this UTI. Obesity and family history are also risk factor for this UTI. Females are more prone because of shorter urethra than males, and during the time of menopause, vaginal flora gets disturbed, and because of this, recurrent UTI occur. And in cases of males, if there is prostatitis, so that inflammation of prostate may also lead to recurrent UTI in males. Now let's talk about the diagnosis of this UTI. So we do routine or microscopic urine examination, and it may present RBCs in urine or WBCs in urine, or any bacteria in urine, pus cells in urine. So routine or microscopic test will help us to diagnose this UTI. Now let's talk about the prevention of this UTI. So one should maintain personal hygiene, especially after urination and defecation. Now let's discuss about the treatment part. So allopathically, antibiotics and topical creams are given for this UTI. Now let's discuss about the homeopathic cause, one of the cured case of UTI via homeopathy, and some of the homeopathic medicines which can be helpful in curing this UTI. So the homeopathic cause is territorial conflict. He feels that his territory border is not being respected by others, or one should not be able to mark his territory. So this conflict leads to UTI. Pain in the kidney region is there, as well as burning and scalding seen in the urethra even before, during and after maturation. After taking whole history, we got the mental symptoms as nobody is giving importance to him. He feels like that he has lost all the values in his family. He is just leading a vegetable life, laughs immoderately at serious matters too, and he is too forgetful. Very much exaggerated person, means a single thing makes him too laugh. So after taking whole history, we took the rubric delusion. He is leading a vegetable existence, and the medicine given was cannabis indica 200, which cures him completely within a period of 3 months only. Now friends, let's discuss about some of the homeopathic medicines which can be helpful in curing this UTI. So the first medicine is Sabalsarilata. It is also known as homeopathic catheter for acute prostatitis and for chronic UTI infections. In this, there is constant dribbling of urine takes place, and there is burning and scalding type of pain within the urethra. The mental symptoms of this Sabalsarilata is they dislike sympathy, which makes them angry, means there is anger from consolation, and irritable, too much quarrelsome person, and starts up from sleep. So if these symptoms correspond, Sabalsarilata will be helpful in curing such cases. The next medicine is Paraira breva. It is very useful in chronic prostatitis and chronic UTI. There is one peculiar position of this Paraira breva, that how he can emit urine. So he has to sit on his hand and his knees, and he has to firmly press his head against the floor. That is namaz position. So in that position only patient can emit urine, otherwise he can't. There is constant dribbling of urine is seen. There is left-sided affections are there in this Paraira breva, and pain going down thigh. There is inflammation within the urethra, and there is violent urging of micturition, especially at night. So if these symptoms correspond, this Paraira breva will help to cure such cases. That's all for today. We'll meet soon with a new topic, new subject. The clinic address of mine and the contact number is given in the description link. It's my humble request to you all, kindly don't take any medicine without consulting doctor. Otherwise, it will not be too much helpful to you. So friends, just subscribe the channel, tap the bell icon to get the latest updates of the videos. Thank you.